One of the things that I heard over and over as I was talking with healthcare leaders at the Vive event was this idea of AI really has some powerful capabilities in healthcare, but we need to keep providers like clinicians, like doctors and nurses in the loop. In this episode of the Tech Glow Up, we dive into a little bit more specific about what in the loop really should mean. So this is an episode with two OGs in health IT. Virginia Halsey is the SVP of Product and Strategy at First Data Bank, also called FDB. For Virginia, she's miffed that pharmacists are spending 30 to 40% of their days just verifying that prescriptions that patients have aren't going to cause problems. Reconciling whether or not this prescription in this amount is appropriate and safe for this patient takes up so much time. This is because the data is fragmented, because there's so many inputs, because you really don't know what a patient is doing with that prescription once they leave the doctor's office. Virginia and her team at First Data Bank are focusing on fixing those workflows and making sure that pharmacists can be involved in checking prescriptions, but not spending almost half of their day. There's some real questions about if healthcare is ready to take advantage of new technologies like MCP in this early stage. Jay Anders, podcast extraordinaire, is another healthcare OG who really brings a fantastic perspective to the show. While nobody's asked him specifically about how he wants to glow up, he gets the idea and is ready for the gauntlet on the show. Dr. J presents an idea that almost every clinical innovator I've heard shares. We need doctors and clinicians involved in innovation more early so that they can help us define what's helpful, harmful, and just plain ridiculous. I don't know if Jay would say it that way. Jay explains how Medicomp is focused on verifiable results from their ambient listening solutions. I'm sure you've heard on several of the episodes from Health that ambient listening, like AI scribes, is taking a lot of the note-taking responsibility out of doctors' hands and literally putting it into the cloud. It's automating these tasks, but physicians, if they're going to sign their name to those notes or those orders, need to be sure that what's being reported is accurate and true. This is why we need more doctors involved in health tech innovation. Shocking that it isn't more common already. We've got Virginia Halsey of FDB, that's First Data Bank, and we've got Jay Anders, who is the Chief Medical Officer at Medicomp Systems.